All right, team, welcome. We're about to jump into one of our most critical safety protocols, pediatric fall prevention. Protecting our youngest patients is just non-negotiable. So over the next few minutes, you'll get a really clear walkthrough of how we all make that happen, together.
So, let's start with the official definition, just so we're all on the same page. A fall is exactly what it sounds like, a sudden, uncontrolled move to the ground. The key thing to remember here is that every single fall is treated as a serious patient safety event, period.
Here's our game plan. We'll kick things off with the why. Why this is such a huge deal in pediatrics. Then we'll get straight into the how, assessing risk, spotting our most vulnerable kids, and putting the right precautions in place. We'll also cover exactly what to do if a fall does happen, and wrap it all up by focusing on the most important part of this whole system, you.
So why this intense focus? Why a whole policy just for this? Because pediatric falls aren't just random accidents. The vast majority are preventable, and we are absolutely committed to getting that number as close to zero as possible.
Think of this policy as your playbook. It's not just a bunch of rules. It's a clear, evidence-based system that's designed specifically to protect our youngest patients from getting hurt. It's our go-to guide.
All right, let's get into the nuts and bolts. The whole process really kicks off with one crucial step, a formal, standardized risk assessment. This happens for every single pediatric patient that comes through our doors.
We have a few different tools in our toolbox to make sure we get it right, depending on where you work. You can see there are specific ones for inpatients, the ER, and outpatients. But for our purposes today, we're really going to zero in on the main one for inpatients, the Humpty Dumpty Scale.
Using the Humpty Dumpty Scale is super straightforward. If you get a score anywhere in that 7 to 11 range, that tells you the patient is at a low risk for a fall. Simple enough, right?
But this is the number you really have to burn into your memory. 12. A score of 12 or more means that child is immediately, no questions asked, classified as high risk, and that triggers a whole different level of care.
Now, it's not just about the score. Some of our pediatric patients, just by their condition or age, are automatically considered high risk. It doesn't matter what the tool says. This is how we build in an extra layer of safety.
If you're working in an inpatient unit, this is huge. All neonates, so from birth to 29 days, every single child in the PICU, and any patient who might have a neurological deficit, they are all automatically high risk.
And the same idea applies over in the ER and our outpatient clinics. Any child who is 7 years old or younger is automatically high risk. This also goes for patients with neurological issues, significant vision or hearing problems, or any child who needs a mobility aid.
Okay, so once we've identified a patient as high risk, what's next? Well, we have to make that risk level obvious to absolutely everyone on the healthcare team. We need instant, at-a-glance recognition.
And this is how we do it. It's a clear, consistent system. For our inpatients and ER patients, a specific fall risk ID band goes on their right arm. For outpatients, it's a designated sticker that gets placed right on the upper part of their clothing. No guesswork.
And here is the final piece of our visual communication puzzle. For every single high-risk inpatient, this dedicated sign has to be posted where no one can miss it, either at the foot of the bed or right on the room door. The goal here is zero ambiguity.
So identifying the risk is half the battle, right? But it's the action, what we do, that actually keeps the patient safe. So let's talk about the specific precautions you're going to put in place.
First up, we have universal fall precautions. You can think of these as the absolute baseline. They are the non-negotiables that apply to every single pediatric patient, every single time, no matter what their risk score is. This is just our standard of care.
These are the fundamentals of a safe room. Make sure the family and the child know their way around. The bed is always in the lowest position, brakes locked. The call light has to be within reach, always. And of course, keep that floor clear and dry.
So what's different for a high-risk patient? Well, you do all of those universal precautions we just talked about. And then you add another layer of protection. This means things like making sure that child is never left alone and physically helping them with every single transfer or walk.
Now, let's talk about what happens if, despite our best efforts, a fall occurs. It is absolutely critical that you follow the post-fall protocol immediately. The key is to stay calm and be methodical.
Your first move always is the patient. Make them safe and comfortable. Then do a quick ABC assessment: airway, breathing, circulation. Check for any injuries, call the attending physician right away, and then make sure that the patient safety event reporting form gets filled out completely.
Let's wrap this up by focusing on the single most important part of this entire system. It's not a tool or a sign, it's you.
I want you to really let this sink in. Our policy is crystal clear on this. These tools, they're just guides. Your clinical judgment, your gut feeling, is paramount. If you believe a patient is at risk, you act on it, even if the score is low. You are empowered and expected to make that call.
So just remember, your active involvement is what makes this whole thing work. It's your sharp assessments, your clear documentation and communication, and the way you educate the family. That's what builds a true culture of safety around here.
So as we finish up, I want you to think about this personally. Based on what we've just covered, what is one specific thing you're going to do, maybe differently or just with a renewed focus, during your very next shift to protect your patients from a fall? Thank you for everything you do to keep them safe.